Hi, I'm Dr. Rajani, and today I'm going to demonstrate the PDO thread lift. Well, what are the threads? You put a needle in, and there's a thread of a material PDO, which is resorbable. You can get them flat. They're coiled to add volume. You can get double barbed, so you can push tissues apart. You can get single barb, and that's what we're doing today. What I want to demonstrate today is using the barb lift to create lift at the edge of the mouth, the oral commissure, which ages people. It's an area that ages people. And why would we want to use that over fillers? If we add too much volume in the lower face, it squares people. And as we age, we're all becoming square. Unfortunately, as gravity drops, we lose collagen and fat from our face. So when we volumize through here, when we lift the cheek, when we volumize the temple, now we might want a little lift at the oral commissure, and you get a beautiful lift with a barbed suture. So I'll take you to the video now, and remember the reason we're using this over fillers, if we add too much volume here or too much volume here to create lift, it looks unnatural. Let's go to the video. I want to show you these brand new PDO sutures, very popular in Europe, in Korea, and in Asia. So let's go and do some PDO threads today. And one of the most important things with all of our procedures is cleanliness. And it prevents biofilm, it prevents the possibility of infection, or at least it reduces it. And especially when we do long-lasting procedures, cleanliness is important. What we're doing here today is, tilt this way, as the face falls, the oral commissure deepens, and this look here, where you get a heaviness at the edge of the mouth, really creates an aging look. What we're all trying to do is create this vector backwards, back here towards the ear. And you can see how nice of a look that is. Now, a patient here in the videos, as you can see before, I had sculptor through here, artifilm sculptor, voluma through here. And so there's not a lot of a downturn. But I don't want to lose that beautiful high cheekbone here by adding too much volume through here, just for the sake of creating that kind of lift. And look at what happens to that jawline when we do it. We're going to use PDO threads. We're going to come in here, and let me grab one here, and we'll see the length of that. So as you can see, we're going to come in up here, and we're going to come all the way down right to that commissure, and we're going to vector that up, and we're going to pull the skin to create that lift. So a little poke here, and we want to be at a correct plane. And this procedure takes some training, especially with these barbed threads. And when there's collagen production, like this patient has already from collagen stimulators, there's a certain degree of strength. You have to get through that dermal layer, and then we push through that, down along the layer. And remember, our aim is going to be here. You see that plug. You never want to pull back on the suture or you'll lose the thread. You can see the thread leave and go into the face. You can see the depth that we're at. And we're going to end right there. That's perfect. Because if you see where our barb is now, the end of the needle is here, and this is what I want to lift, that edge of the mouth, without having to volumize. Now, it's important what you do here. You can see my end. Now I can feel the tip of my needle, and I can feel the skin. Now, I'm even going to get a little ultrasound gel here, arnica type gel. Put it on the skin. That's our other point that we added one below here. And you can feel the barbs beneath here where the suture is, and I'm pulling up and vectoring up, and you can see where that is. You can almost see it pucker. And as I pull that up, okay, I'm going to hold the skin up, get a little bit of traction, hold the skin up. I'm going to pull this out, and the suture will there be left in place like magic. And I continue to pull up, and look at that beautiful lifting of the oral commissure. Now I'm tempted to add a smooth, smaller one along that vertical lip border, because now that this is lifted up, I can create a little more of a ski jump in that lip and create a beautiful lip. When the mouth is turned down, and then we try and create a very youthful lip, it looks incongruent. But now, as we lift the edge of the mouth without having to add volume, there's no filler in here. Now we can create a beautiful edge of the lip by just putting a thread along the edge of the lip. And there's coiled threads that you can use to volumize, or there's straight, smooth threads. But the barbed thread that we use today is a little more of an advanced technique because you got to get the right depth. And look as I pull up. As I pull up on that suture, look at the edge of the lip, and that oral commissure disappeared. So there you see the PDO thread lift. It's a tool in our toolbox, our armamentarium of anti-aging. Remember this, the threads resorb, they maintain a degree of lift, the material lasts anywhere from 3 to 6 months, and the result anywhere from a year to 2, depending on aging. You can add more as you like, and there's all sorts of different threads, and we'll show you over the coming year lifting the buttock area, the knees, building collagen there. You can use it in the lips, creating lift at the edge of the eyebrow, all kinds of fun stuff to come. Stay tuned to this channel. Click like if you've liked the video, and subscribe for weekly or bi-weekly updates on further videos that we do on this and other anti-aging and new treatments that are coming to market. Thanks for joining me today.